Let's see about movements for extraction. So the movements for extraction is very important. So before extracting a tooth, the following assessment of the tooth should be done. So first we have to check the morphology of the crown and morphology of the roots with an X-ray. If it is fused, ankylosed, dilacerated, hypercementosed and divergent roots. Before you are going to extraction, we have to know these morphology of the roots because these types are difficult for extraction. So the position of the tooth in relation to the adjustment teeth and other hard and soft tissue structures in the line of the extraction and the density of the bone surrounding the tooth. So mostly if the tooth having before or after there is no tooth, then there is bone density is more, so it is difficult for extraction. So keep in mind the pathology like an abscess or cyst in the tooth or the bone surrounding it, and make sure, it is very important, make sure that proper local anesthesia is given to provide a painless extraction. If we provide a painless extraction, then patient will cooperate. So first we are going to see the movements or forces applied to extract the maxillary teeth. So the first one is here the maxillary or the upper teeth. When requiring the extraction of the following forces are exerted, the forces exerted are different for each tooth. So but the first pressure applied on the maxillary tooth while extraction is apical force. Is very important. The first force in maxillary teeth we have to apply is apical force. That's only the PDL is tiered. It's easy for extraction. And the beak of the forceps should engage the neck or tooth or below the cervical region of the tooth. If not, the crown can break on applying forces of extraction. So we have to place the beak of the forceps to engage the neck or tooth or below the cervical region. Let's see about the forces to extract central incisor, that is maxillary central incisor. How will you extract? So apply apical force first to engage the forceps in the neck of the tooth, continue with labial pressure and then lingual pressure and followed by mesial rotation, and lastly give a pulling motion or occlusal force to extract the tooth. So first we have to give apical force and then give labial pressure and lingual pressure and mesial rotation. So mainly the anterior teeth for extraction we have to give the rotational movement, and lastly give the pulling force. And next we are going to see forces to extract lateral incisor, that is maxillary lateral incisor. So apply the apical force first to engage the forceps in the neck of the tooth, followed by, see it is similar like maxillary central incisor, that is labial pressure, then lingual pressure and again labial pressure, and lastly give a mesial rotation and pull the tooth out of the socket. So same steps, first we have to give apical force and labial pressure, then lingual pressure and mesial rotation and pull the tooth. Next we are going to see forces to extract cuspids or canines. So these are the teeth having a longest root. So first we have to give apical force first to engage the forceps in the neck of the tooth, followed by labial pressure and lingual pressure and again labial pressure, and lastly give a mesial rotation and pulling motion to pull out the tooth from the socket. So the same steps for maxillary central incisor and lateral incisor and maxillary canines. These are the rotation for maxillary anteriors. Next we are going to see forces to extract maxillary first cuspids or premolars. So how will you extract? First premolar. So apply apical force first to engage the forceps in the neck of the tooth and apply buccal pressure followed by lingual pressure and give a pulling motion. So while applying buccal force to pull out the tooth. So first here there is no rotation. We have to note that point. So first we are going to see apical force, give apical force and buccal force, and followed by lingual pressure and pulling motion with buccal motion. And next we are going to see forces to extract second premolars, maxillary second premolars. So first apply apical force. First we engage the forceps in the neck of the tooth and apply buccal pressure and followed by lingual pressure and give a pulling motion while applying buccal or lingual force to pull out the tooth. So first premolar and second premolar are similar. The movements are similar for both. There is no rotation. It's very, very important. The most difficult tooth for extraction is first premolar because the roots are very slender and two roots. Next we are going to see movements for molars. So apply apical force first to engage the forceps in the neck of the tooth and then given buccal pressure and followed by slight palatal pressure, not heavy as it might break the palatal bone palate. So slight palatal pressure and lastly give a distal rotation. Here is very important, distal rotation. And once luxated, you can give a figure of 8 motion. That is figure of 8 motion and pull the tooth occlusally to extract the tooth. Next we are going to see forces or movements applied to extract mandibular teeth. How will you extract mandibular teeth? So first one is forces to extract mandibular central incisors. How will you extract mandibular central incisor? So apply apical force first to engage the forceps in the neck of the tooth, continue with labial pressure and then lingual pressure and followed by a slight mesial to a distal rotation. I already told for maxillary anteriors we have to give the rotational force. Here mandibular anteriors also applied this rule. So lastly give a pulling motion towards labial direction to extract the tooth. Next we are going to see forces to extract mandibular lateral incisors. So mandibular lateral incisor, apply apical force first to engage the forceps in the neck of the tooth followed by labial pressure, then lingual pressure, followed by a slight mesial to a distal rotation. Lastly, pull the tooth out in the labial direction from the socket. The next tooth is mandibular canine. So, how will you extract mandibular canine or mandibular cuspids? What are the forces to extract cuspids? Mandibular cuspids or mandibular canines. Apply apical force first to engage the forceps in the neck of the tooth followed by buccal pressure. Lastly give a mesial distal rotation and pulling a motion to out of the tooth of the socket. So for all anteriors we have to apply rotational force, buccal or labial pressure and rotational force. So next we are going to see forces to extract first premolars, that is mandibular first premolars. Apply apical force first to engage the forceps in the neck of the tooth and apply buccal pressure followed by slight mesiodistal and pull out of the tooth. So buccal pressure and mesiodistal and pull out of the tooth. And next we are going to see how will you extract mandibular second premolars. So forces to extract second premolars. Apply apical force first to engage the forceps in the neck of the tooth and apply buccal pressure followed by slight mesiodistal and pull out of the tooth. The mandibular premolars are same. First and second premolars are same movements only. There is no difference movement. Next, we are going to see forces to extract mandibular molars. What are the forces or movements? So apply apical force first to engage the forces in the neck of the tooth, and then give buccal pressure and followed by slight lingual pressure. Lastly, pull the tooth towards the buccal or lingual direction to extract the tooth. So we have to give buccal pressure and then slight lingual pressure and pull the tooth towards the buccal or lingual direction to extract the tooth. There are two types of extraction. They are intra-alveolar or closed type, which does not involve any tissue cutting or damage to surrounding tissue. The tooth is extracted in a simple manner with forceps. So, simple manner. We don't have to give any incisions or sutures. It is a simple extraction, that is intra-alveolar. The other type is transalveolar or open type, where there is less use of forceps and a mucoperiosteal flap elevation is done to extract the tooth surgically. So, these are the two types of extraction, intra-alveolar or transalveolar extraction.